for this panel are joined by a couple of business leaders, thought leaders. I think what I find so inspiring about each of them is the work they've done to kind of implement focused, systemic, effective, efficacious behavioral health programs. And I think what you'll find is across three very, very, very different sectors, communities, spaces, whatever word we want to use. Before I introduce them, our format for the next, oh guys, we've got like an hour and a half together. You guys okay with that? We have an hour and a half together, but for the next hour and a half, I just want to give you an idea of what to expect. We'll go through some introductions. I'll stop talking because we're here to listen to them, but we'll do some introductions. We'll talk a little bit about why they do what they do, how they got to doing what they're currently doing. And then we'll wrap with some conversation around kind of those tools, those ideas, those actionable insights that each of you can stick in your back pocket, carry with you. We love the stories. We love to talk about the why. We really want to get to the how. We want to make absolutely certain that you have something, again, to stick in your back pocket. All right. So that said, I already alluded to this earlier, but we're joined by three panelists who come from three very, very different, unique vantage points. And we're going to start the first question, and JJ, I'm going to look to you. We're going to start with some introductions. Introduce yourself. Tell us what organization you work with. Tell us the space you're in. And then tell us a little bit about why you do what you do. JJ, starting with you.
Great, thank you. And thanks for having us here. Really appreciate being invited. It's such an important conversation, obviously. I'm JJ Bartlett, founding president of Fishing Partnership, and we're a nonprofit company that's been improving health, safety, and economic security of commercial fishermen and their families since 1997. And I wanted to start by saying that we're really lucky here in Massachusetts to be living near the most fertile fishing grounds in the world. And more non-male fishermen are joining the industry to harvest those waters every day, but they still prefer being called fishermen. So I always bring up right up front that that's the term that I use, and I'll be using today. And I also I do this work because the people who feed us in the United States and the people who feed our families have been living through an unaddressed healthcare crisis for decades, and they're really sick. And they need help so that they can support their families, so they can feed our families.
Thank you, JJ.
That's why I do it.
Thank you. Thank you. Maggie, you know what, Maggie, before you chime in, you'll notice that Maggie has a slightly different background than the rest of us. And we're kind of excited about that because in a minute, you're going to learn where Maggie works. And hey, we have an opportunity to kind of peer into Maggie's reality, Maggie's day-to-day. So thanks, Maggie, for joining.
Thanks so much for having me. And yeah, we're flipping this tech issue into a real live time. At one point, we will show you the inner workings of Harry's, and that's where I work. Hopefully you might have heard of us and heard of our brand before. We are a family of omni-channel brands. And one of the commonalities for all of our brands is that we donate 1% of sales back to nonprofit organizations. And our Harry's brand in particular, we get to donate to men and men's mental health. We work with amazing organizations like Mindwise and so many others that are doing the work every day. In the next few years, or 2 years actually, now that the time is going on, in the next 2 years, we'll reach 1.5 million men and make sure that they have access to the mental health care that they need. And I think, you know, why I do this work, I think this is just another step in my life and journey and service. I think, you know, this is just an interesting way that I could give back. I have worked in nonprofit for over 15 years before coming to Harry's. and worked in program and worked in corporate fundraising, and eventually landed here, which I think is just the best role at Harry's, and that I get to think about how we can be better in the world every day. So
Mm.
yeah, that's a little bit on our work and why
Oh,
I'm here.
I love the use of the word journey. We're going to come back to that, Maggie. So fisheries, Harry's, and now Jamie. Who are you, man?
Hi, hello everyone. Jamie Evans. I'm the regional director of safety and workforce health for Turner Construction Company. Turner, great company. I'm blessed to work for them. I've worked for them for 23 years since I left the military, and you know, they're very cutting edge. We're the largest upright builder in the country. Do like something like $17 billion worth of work a year in volume. And my position here is really safety for many years, 18, 19 years, but then this focus around behavioral health and workforce total health became kind of my role morphed into that out of a need. So what got me here, we just needed to be better. We needed to execute buildings better. We needed to do it cleaner. We needed to do it with less accidents. We needed to do it with less trauma through the process. And we're bringing in people from multiple different walks of life, generations, and spaces. And we're bringing everybody together on this job site to get this building done. And for me, what my journey started several years ago when we actually partnered with MindWise. We brought them in because we were stuck. We couldn't seem to make that next big drop in our what I'll say our efficiency from an accident standpoint. And that's when my partnership began back in 2018. And from that, we've really started championing what we call behavioral health and construction, behavioral health and wellness. And since then, it's just become organically, it's become a part of the safety function. We've always tried to keep people safe. This was that next evolution on how we could make the next step as an organization to really, really instill genuine caring for the workers. It also helped us understand, you know, almost a little late, but we were on the train in time. Similar to what JJ said, the need of this population and our population of construction workers that are, you know, the disease states and situations where they are disproportionately impacted. And for us, so that's how my work came. It came about being better from a business side, but I've always had a passion for people. That's if you're in safety, you kind of have that passion for people. And this really, this work informed for me from a strategic standpoint. I say this is, you know, the safety manager of the future. You gotta know this stuff. It's not just about putting bolts in iron anymore and scaffolding. It's about people, and it's about setting strategies that will help our industry be better. So that is why I'm here, and great to meet everybody.
Thank you, Jamie. Thank you. We've worked together for quite some time now, and it's been quite fascinating, if not inspiring, to kind of watch your journey. Maggie's word earlier, your journey in developing, taking on new roles and responsibilities, doing what you know is what's best, not only for your population, but for the business of Turner. Okay, so 3 very different vantage points. Maggie with Harry's, JJ fisheries, Jamie construction. JJ, starting with you, knowing that this vantage point is so unique, what started it all? Like what were those unique mental health challenges, behavioral health challenges that you were experiencing that kind of necessitated what it is you've done over almost 2 decades?
You know, I started in the mid 90s, and you know, I, like many of us, recently read the Perfect Storm, and it was somewhat prepared for the trauma and adversity due to the danger of the work that the fishermen live with. I wasn't prepared for how sick the uncertainty of the job made the workers. You know, fishermen and other workers, especially independent workers like them, are dependent on forces that are outside of their control in order to earn a living. You know, the weather, fuel prices, the price of the catch, science, government interventions. This can be incredibly stressful. One example is prior to 2010, you know, 2008, 2009, everyone agreed, the fishermen, the government, the scientists, there were plenty of cod in the ocean. And fishermen in Massachusetts did what family businesses have done for generations. They invested their money back into their businesses. They bought boats for their children. You know, they bought quota. And in 2010, you know, there are lots of different reasons, but why this might have happened. But fishermen were told by the government, we were wrong. There are no fish, and your quotas are worthless. And we had people who, you know, had lived solid middle-class lives, had put their children through college, who are now calling us saying, we don't know how to put food on the table. We don't know how we're going to pay for the second semester of, you know, of school this year. And Northeastern did a study of the people that went through this disaster. It was declared a natural disaster when the codfish crashed in 2010, just like when tornadoes or hurricanes hit. And Northeastern did a study and found that 2/3 of the fishing families who went through this financial crisis were suffering mild or severe symptoms of post-traumatic stress disorder based on the financial crisis, not the fact that fishing is 29 times more deadly than any other job, but because of the uncertainty, financial uncertainty. Now, this may be hard, you know, for landlubbers like me. I came from health policy, and I imagine most of the people watching this to understand. But I remember thinking a couple of years ago, in the heart of the COVID pandemic, we are all fishermen now. We know what it's like now to have to make life and death decisions on, you know, who to visit, whether to wear a mask or get a shot, or where we can, you know, go out to eat, based on information that we don't trust. And, you know, agencies that we used to trust, we're now, you know, questioning or trying to find the one person that we might agree with. And, you know, I'm afraid that we all know now a little bit more what it's like to live through the type of uncertainty that workers like fishermen have been living through for decades and generations, and the, you know, and I'm afraid that we're also about to feel the and are starting to feel the adversity that presents.
The uncertainty, the
Yeah.
PTSD tied to financial uncertainty. And then again, the first time you used that expression, we are all fishermen, it blew me away. So something for all of us to take with us, again, something to stick in our back pocket as we leave this session. We are all fishermen. JJ, thank you for that context. Maggie, so again, unique vantage point. What struck you about the mental health needs, the behavioral health needs of the population you were looking to serve?
Yeah, and I think I should say, like, you know, a little bit on our path to this cause area, mental health, and how we got here. You know, I mentioned before, we donate 1% of our sales back to nonprofit organizations. And when we were looking at, you know, what are we going to focus on? Where are we going to put our money towards? You know, we were working with a bunch of partners at that time that were working with men, and we knew we needed to start there for men's grooming brands. You know, we needed to start with men, and it led us to this question, like, what is the challenge with men today? And when we were working with these nonprofit partners, just over and over, just this theme emerged, that it was mental health and access to mental health. So, you know, when we were taking on this cause area, we also along the way needed to look internally. And, if we're going to talk about this out in the world, if we're going to give a lot of money towards it, we need to practice what we preach. And so there was a little bit of a vetting process that happened internally. Like, are we actually good at providing our team with the mental health that they need? Turns out we felt like we were comfortable enough, to start, and we were open about it. There's some things that we're working on, there's some things that we're better at, there's some things we really gotta kick into gear. And then I think the pandemic happened, and then I think it just totally changed the trajectory. And you had brands talking about mental health a lot more, which was exciting to us. Actually, we have always said, like, the more the merrier. The water is warm. Like, how could we share what we have learned? Can you share what you have learned? There's no preciousness around this space because the need is so great. And so I think that brings me to, like, what was shocking to me was the actual need. A recent study came out, I think it was last year, that said that 0.5% of philanthropy globally goes to mental health. 0.5%, like across the world, not just in the US. And that is absolutely shocking. And you look at the total number, it's like $150 million. And, we're donating like $12 million. Like, we're a significant portion right now of the corporate dollars that are going, corporate philanthropy dollars that are going into this space. That is not enough. We are just one company doing this work. So I think what was totally shocking to me was more on the philanthropy side.
Yeah.
That there's so many programs, nonprofits that exist, programs that are evidence-based, programs that we know work, that have been tested for years and years, and experts in the space, but the funding just isn't there. So these programs are smaller in nature and are gonna take time to scale. So I think that was like the biggest surprise and shock of all of doing this work, and we're talking about the size gifts that we give. These are huge donations to nonprofits, and they had never heard those numbers before. And I don't say that like we are, I am proud of that. I'm happy that we were able to do it, but I think it speaks to the lack of funding in the space. It's just totally astounding. And then I think when you dig deeper, and you particularly some of our partners that are doing things like LGBTQ mental health and things like Black community mental health, you can see how wildly inequitable the space is, and how we have such a narrow view of mental health. I think, our Black mental health partners are absolutely amazing, have been doing this work for years, and have really helped us, like, remind us of how narrow sometimes when we talk about mental health and mental health solutions. How community care is so important, how support groups are so important. There's no one-stop shop or solution, as we all know, but they have showed us, like, what cultural competence means in this space. And quite frankly, the lack of cultural, like, evaluation and research in this space is also shocking. Like, there is nothing, like, we are just understanding the needs for access to care and mental health. We have not yet teased out how that affects particular populations at a particular time. So, yeah.
Maggie, okay, let's be honest with each other. We could spend a day, each of us, just listening to Maggie, just listening to JJ, just listening to Jamie. There's a lot here. Maggie, this idea of this organizational introspection that inevitably led to some semblance of a culture change, this idea around change, acknowledging where the organization was, and where it needs to go or where it will go. That's fascinating, and I think we should revisit that in a minute. This idea of cultural competence, let's come back to that too when we get to those clear action steps, like the stuff we want all of you to stick in your back pocket and take with you. Maggie, thank you. Jamie, what struck you 4 years ago, 10 years ago, when you started in construction about the mental health needs, the behavioral health needs of the sector you work within?
Yeah, Brian, thank you. I think what really jumped out to me once we started doing this research, and really pulling data together to be able to show the problem to leadership, to the organization. When we were able to show the problem that needed to be solved, I was really shocked about the impact of the opioid crisis in the construction industry. And the fact that for every one construction worker that dies from a fall or a trench collapse or crane incident or any of those things, electrocution, for every one of those, there was something between 8 and 10 dying of an of an overdose. So that was when I looked at that, and then when when the CDC released its study, and we pulled that information together, we talked to the EAPs of our partners, our union partners that employ the workforce, right? They provide the workforce. And we pulled all that together, and all of a sudden you realize, wow, if you're in construction, you're, over 10 times more likely to die by suicide or an opioid overdose, right? For every one that dies on the job, I think it was like 14 died elsewhere. So that was shocking when we were able to frame that and get with OSHA as well. And it was surprising also. What was also surprising for me is when we started having these conversations, how the workforce was ready. There was pull.
Mm.
And that was really interesting for me. The other piece was the safety function. So we have a lot of safety people, and this is one of the more rewarding things of how we were able to take someone who had a job and a position based on accountability and controlling behavior, right? It's kind of what you're doing in business and construction. How quickly that group adapted, took it on to like, wow, this is part of what I need to do now. I'm all in. And it was, again, a lot of pull. And I think what I like it to, whether you're my age, older, or you're young, because we have a range of new hires, right? We bring people in new, we develop them, and we have a broad spectrum from 60 to 22 out there doing our function. Across all generations, the increased purpose it gave people. And I think, it can be hard work. And I think, people want purpose, no matter what. Generational differences beside, right? Everybody says certain generations work harder than others and all that. People want purpose, and they don't mind hard work. But if you have purpose, that's fantastic. And I think this work gave people this different level of purpose and made them more committed. We have their commitment. And nowadays in business, it is so competitive in the construction market to keep people in, to do the buildings. No longer is it about control and we need people that just do what we tell them to do and follow policy. That's not going to get you there. That will not help. You won't grow there. You need to get people's commitment. You need their ideas, their skills, their talents. We need everyone's too, not just, the typical, maybe stereotypical construction worker. We have, women that are ready to do this work and they want to bring their skills here. They need to feel welcome, right? We have the LGBTQ community that are ready to come here and do this work, build buildings, weld, and do these things. They need to feel welcome. We need all people to come in. And part of, I think, when we talked to the intersection also between, I want to say inclusion and mental health, behavioral health, that intersection was surprising to me about how this really can set a foundation for these other conversations. If you can make it safe to talk about mental health, right? You can make it safe to talk about many other things. And mental health, behavioral health affects everyone. So that piece was probably the most surprising, just how rewarding the work was and how quickly it started to take off. Not that we have it figured out. We do not. We do not have it figured out. We're still working. We're still trying to figure it out. but there's there's gold in those hills, Brian.
Oh, I love it when you say that. Yes. So you talked a little bit about kind of the problem to solve, and you framed that up nicely for us. You also talked a little bit about there was an appetite. There is an appetite, and that surprises some of us to realize just how much of an appetite there is for people to have these conversations, albeit, again, necessitating safe spaces to operate. You also talked a little bit about this, the days of quote unquote command and control are over. How do we elicit the voice of the workplace, that bottom up? How do organizations meet in the middle, that top down, bottom up? And Jamie, I know the work you're doing, and I know that's continues to be some of the work you're doing, meeting in the middle. Again, command and control no longer being a viable option. So the three of you, and please correct me if I'm mistaken, but none of you are social workers. None of you really came up and are licensed clinicians, therapists, anything of that like. How have you over the last, over the last 5 years, start with just over the last 5 years, how have you learned about this stuff? JJ, how have you learned about trauma systems? How have you become, in a sense, the expert that you've become as a non-clinician?
Well, I don't know what expert I've become yet, but I appreciate that that introduction.
Oh, I love, yep, I appreciate that.
It's interesting taking working on this job. It's palpable. The fishermen are 20 times more likely, as I said before, to die on the job. It's not just fishermen. One of the things that I learned early in doing this work is that there are a group of workers that we call workers without a net. But there's a group of workers who share 3 common characteristics. They have high rates of pain and injury on the job. They have low access to sick leave, paid sick leave or paid vacation leave, and low job security. So you're talking about fishermen, also, Jamie's construction workers, farmers, and jobs that traditionally employ more female workers, home health aides and food service workers. And it doesn't matter if, you tear your rotator cuff pounding a nail into a roof or carrying a tray. If you can't go to your boss and say, I need some time off, you're going to have to suffer through pain. And it's no wonder that when you combine that with like I said, the uncertainty of the job, that it results in some terrible health outcomes. Fishermen and the groups that I mentioned are among the sickest workers in the country. They're among the workers who are most likely to die on the job, most likely to die by suicide, most likely to die by opioid overdose, most likely to be uninsured. And they're on the bad side of every CDC study out there. What's been fascinating is that given all of that, they get less support than other groups. As independent workers, there's no human resources department to take care of them. And so that's what we set out to do. We essentially created a community-based human resource department. So how we do our work is as important as what we do. We have offices up and down the coast that are staffed by members of fishing families and fishing communities. And they are highly trained as community health workers. And they know the needs of the industry because they're from the industry. And they know, they tell us, what problems there are. And we just try to put together the best training we can for them to help the communities. They literally speak the language of the communities, Italian up on the North Shore and Portuguese down the South Coast. They figuratively speak the languages of the community. They know that if it's really cold, it doesn't really matter. The fishermen are going out fishing, but if the wind's blowing, that's when the fish will be at the dock. The fishermen will be at the dock, and it's a great time to go down and speak with them. And they and like I said, they've been trained to bring services. So now we're able to bring safety training to fishermen that they were not eligible for before. OSHA's jurisdiction isn't the same out at sea as it is on land. They sign people up for healthcare coverage and provide Narcan and other sorts of trainings. So anyway, that's the model that sort of has developed from what we've learned.
Well, and I like where you started. You started by saying the work, the experiences, what you're exposed to is palpable, and that is what has in some way kind of informed, inspired your learning. Okay, we won't use the word expert anymore. Jamie, Maggie, we're not using the word expert anymore, but that is what is kind of continues to inspire you to better understand this space as a non-clinician. Maggie, Jamie, do you care to chime in on what you're doing as a non-clinician to continue to better understand this space we operate in: behavioral health, mental health, pain management? Either of you?
I can jump in and
Sure.
share. I think it's like, to your point with not calling us experts, because I don't feel that way at any day. But I think like really leading on experts here, like we mentioned, or I mentioned before, like this is not a new space. I think for like workplace mental health, this is a newer space. I think a common understanding, a societal understanding of mental health solutions is a newer space for folks. And I just think this is like a very, I think this is a very exciting time. There are plenty of solutions out there. I think that we need to not be the experts, like just have a lot of humility. Like we are a men's grooming brand. Like we need to lean on our experts and what people are telling us and who work in the space and in the field every single day. And I think that goes actually for workplace mental health too. And we think even about our team, like I think like Jamie and JJ, they're like experts in the space, and like, but we, this is a newer space of understanding what the needs of your employees in terms of what you can provide, what legally can you provide, all of these things. And I don't say that to be doom and gloom. I actually think that that's super exciting.
Yeah.
That is like such an exciting time. You are on the cusp of all of these new innovations that are going to happen. I used to complain that I used to go to panels and like trying to look for like workplace mental health solutions, and everyone would be so theoretical and so up top, and there would be no like concrete solutions, which I know we're going to get to, but like very practical things. Like, no, literally, if I had 10K, what could I do with 10K tomorrow? Like if I had 100K, what could we do? What if I had zero? Like what could I do? But I actually think that's like a super exciting time, particularly for some, some of us who work in an office space, like, and have people, people teams and people operations teams and benefits teams. Like you could be a young 20-something-year-old and come up with a new solution that is going to be scaled across the country as like the new thing that's helpful in workplace mental health. So I think that there's like, that tension, I think, is really fun and exciting. It shouldn't be all like, what do we do? There's nothing that works. It's like, no, let's like actually just try everything, and something's got to work and something's got to click.
I think what's becoming clear to all of us, those of us participating, those of us listening, Jamie, to you, Maggie, JJ, is there's a clear bias for action across the three of you. And not to put words in your mouths, but Maggie, what I kind of heard you say is we don't need perfection. We just need to go and do what is good enough. What are those solutions? What are those things we can do to better those we serve? We provide products for, whatever. As a sidebar, I just want to make it clear to all participants that, Maggie, the fascinating place you're in right now is you're talking as much about workplace behavioral health as you are your customer base, and the products, the solutions you provide your customers. I think that's just such a inspiring, but I think that's a really interesting business challenge that I think maybe we'll talk a little bit more about later. But I wanted to make sure everyone understood that Maggie's kind of right in the middle, workplace Harry's, as well as Harry's customer base. Fascinating. Okay, Jamie, you were off mute. Did you want to jump in and talk a little bit about this kind of non-clinician business perspective?
Absolutely. I to Maggie's point, I thought she said a couple awesome things about, one, the excitement. We're going out there and you're trying to make a difference, and you're trying to see what works and replicate it and scale it. And my business is very linear. We build buildings. You get a client, you got a problem to solve. They have a design. You got to get permits. You got to do this. You got to do this. We need the steel guy. We need this guy done here, and we need to close it up so the people can be in it. Very linear. And with this topic, it's go do, try to do good work, right? With the best intention. You will have a little bit of HR saying, maybe, pulling on the reins. Whoa, what are we doing here? This is different. I'm not used to this. Because I really do think since the pandemic, it has kind of changed the HR function, or there's a lot of uncertainty there. Like, how do we talk about this stuff, right? Where does it become? How do you talk about it if it's a performance issue? Are you okay to talk about it, right? And it's difficult. Like, it's difficult to figure that out and get everybody comfortable. But Maggie, to your point, I think you kind of said that. It's like, wow, this is uncertain times, but it's fun and it's exciting because it's all about people and helping people be the best version of them. So that part is really, really neat. And how we did this amazing, one of our coaches, we have what we call medical people in medical trailers on job sites. Their old function was to come in and, hey, you have to take a drug test before you can work here. Take the drug test, make sure you're good. It's an instant test. Okay, go to work. If you have an injury, don't go to the hospital, come here. We want to check it out. We want to clean it up, get you set. So, we can manage it here versus having like these recordable injuries, right? Which then affect your mod-rate insurance and stuff. So it's very insurance-based and injury management-based, right? And since our discovery, we really took those medics and we said, hey, we're no longer having just medics. We're not policing drug testing and handing out Band-Aids anymore. We want wellness coaches. So to all our vendors, we want mental health first aid folks. We want people that can get in front of a crowd of workers and talk about suicide prevention. We want you to be able to do biometric screens. We want to be, active listening skills. We want motivational interviewing skills. So that function changed for us. And one of the young folks, they did this amazing card. It was a card. They said, how do we get people to talk about suicide prevention in construction? We go stand in front and talk to them. What they did is they created a card. It was, what would you say to someone if because a lot of times it's hidden, you don't know who's suffering. You might know it here and there, but not everybody. Half the people you may not even know. And the card was basically designed to say, what would you write to someone that was suffering if you knew it? And went out and did this on a job site and had all the construction workers write in a message on a card and posted it on a wall, right? With all these really great messages from these early construct. One of my favorites was like, if my time can help save your time, call. And Paul, a big giant guy, not the guy you'd think you'd sit down and have a conversation with. So really touching stuff. That one little card on that job site last year, that got out. And this year we had 100,000 construction workers had the opportunity to do one of those cards this last September on all our job sites nationally. And that was one person with one idea to say, hey, how can I engage people? And not just hang up a poster and give them information. Hey, here's the number. How do I get them to participate? How do I get someone to participate in this in a way that's doesn't impact the production and the work? So to Maggie's point, I think that's where the little ideas are coming from. And it's just amazing. It's amazing to watch. And it's amazing, you know, when that person knew they just did this nationally, just what it did for them. You know, they were walking on the clouds. It was really cool.
Mm.
And from a non-clinician, actually, your question, hey, you got to have trusted resources,
Yeah.
right? You just have to be open to learning, listening, and realize there's not just a management solution here that leadership can say, hey, can I go do, okay, what do I need to do? Did I do it? Am I done? It's not that, right? So.
Well, Jamie, you just gave us the best segue. And there's someone in Q&A and chat already just appreciating what you said about the card idea. Again, something that some of us can stick in our back pocket and take with us in our workplace. So let's do that. Let's segue to where to begin. Guys, the need is immense. The need was immense. JJ, you said 20 years ago. The need was immense pre-pandemic. The need is immense today. Someone kick us off. Where, as an organization, nonprofit, for-profit, where as an organization do you begin recognizing how immense the need is as defined by, or is defined by the way you defined need? Where do you begin?
You know, I'm unmuted, so I'll jump in.
Oh, that's funny.
You know, I ran a health plan for about 15 years before for the fishermen. That before we started the community health worker program that we're running now, as health insurance became more available around the state and then the country. And I saw the data for years. And it's just, as Jamie described, if we're talking about opioid use disorder, it's no surprise when you're looking at groups that have high rates of pain and then they don't get paid if they don't work.
Yeah.
They're going to be prescribed opioids. And now we know that, you know, 10% of the people who are prescribed opioids can, you know, develop into substance use disorder. So it's not shocking, but I think that, you know, if I take a step back to answer your question, I remember my grandparents whispering cancer. They wouldn't say it aloud. And now mental health is like that. None of us talk about it. So the answer to your question is stigma, which is where I'm going. Addressing the stigma that we all have around this. You know, and so what I was going to say is I've seen the data and I saw that fishermen, two things were true. Fishermen were about 3 times more likely to be in rehab than, you know, I only saw the results of people who were going into treatments, but I could see fishermen were about 3 times as likely to go into rehab as other groups. Also, it was about 3% of the population in general were in rehab, and then like 7% of the fishermen were in rehab. The point that I'm making is 90% of the fishermen are walking around saying, why does everyone consider us drug addicts? Because of the TV and the movies that they watch. And overcoming, you know, they just come in and that makes it very difficult to address because they're feeling like they're considered lesser than, you know, by society. So how do you even start the conversation? They're feeling like they're going to be, their vessel might be boarded if they have Narcan on it, to take care of someone. And so, you know, many people make the mistake of addressing the 90% of the people as if they're the 10%. And so what, you know, and again, I just get the benefit of having, you know, all of the the kind of built-in focus groups that the navigators provide. And one of the navigators was able to come up with the idea, say, fishermen are really the first responders out there at sea. They're often the ones who are the first people who get to other vessels, whether they're recreational vessels or other fishing vessels. And so let's approach them as such. And so we were able to get a grant with the City of New Bedford, so that fishermen are non-traditional first responders, and along with firemen and ambulance drivers and EMTs and policemen we're trained, and fishermen are trained to use Narcan and put on their vessels, and it's working not just in the fishing industry, where we're having vessels come upon other vessels who need their help, but we just had a call from someone who saved a life on in a car. Someone was pulled over on the Southeast Expressway. Someone else said, I thank you for your CPR training. I was able to save a 5-year-old who was drowning in a pool this weekend. But it all, it's sort of related to the note card that Jamie was talking about. We just getting everyone, on the same page and able to talk about this in a way that's not stigmatizing is critically important.
I like you. There are a couple of things, and I think we could define them as best practices. You started by saying, and again, JJ, forgive me, I'm just kind of stringing this together, but you started by saying follow the data, understand the data. I get that. I think that's pretty actionable for our participants. You also, in some way, kind of talked about getting to that shared understanding. How do you get to a shared understanding? How do you recognize what current state is? Well, data plays a role. And then those focus groups that you talked about play a role in getting to that shared understanding of current state. Do we agree what current state is? And then thirdly, you talked about stigma, and whether that's through, say, tools like Jamie's card or other tools, just combating, addressing, tackling stigma. I loved your comment on cancer. I say that all the time. That's my grandparents. My grandparents would whisper cancer. So what other, again, Maggie, you're in a unique situation, workforce, customer base. The need is immense. Where did you begin? How did you begin? Where did you begin?
I think I've seen, or there are two things that come to mind in terms of like very practical solutions. I think if you are an organization that employs a certain amount of people, to have some, what we would call like a mental health guide and how to, I think you can have like all of these resources and benefits, but like folks don't really know where to start, and literally just like laying out the flow for them. Like, have you like EAP, this is the number for EAP, here are the other services that you have, here's what could be included in your insurance, here's what Harry's offers that's extra, here's how to talk about it with your manager, here's manager how you talk about it with the folks that you manage. I think just like having in one place all of your mental health benefits and supports is actually really critical. And that's, again, like that's a project that like a younger person could do, would be thrilled to think about, and like provide so much value to your organization. And that just like gets me excited too, that folks could get involved in the work where you don't need like you might have to have a head legal look at it, but you don't need like that many signs off. These are like benefits that already exist. Like, how do you actually just map it out for your employees? So that's what I'd say is like very practical, like mental health, like workplace solution. And I think sort of in the same vein, what we're hearing from our partners, particularly from our veteran partners, is like just humanizing the access a little bit. when we were starting to work with veterans in particular in this population and hearing all of the stats and like what they have gone through to get access to care. I will never forget. We actually brought a bunch of veterans into our office and decided to just like, let's just talk about your experience. And this is through our nonprofit partners, and they were very open and honest because we were going to do a veteran campaign. And like, what do we know? We only had a couple of veterans on staff. So we needed to really learn. Anyway, what I'll never forget, one of the veterans told us that they were like talking to their dentist and needed to tell their dentist like their suicidal ideation. And it's like, that's on your record, and that is on your record, and everyone is going to ask you about it, but no one's really going to give you the care that you need. They aren't going to humanize the care. And, quite frankly, he was like, this dentist was not trained in mental health and could not even talk to me about it. It's on your record permanently. There's these bureaucratic, huge barriers to access. And so that's what our nonprofit partners have done, of just like make that more human. So Stop Soldier Suicide is one of our partners in Headstrong, where they will literally call you. They'll call you within 24 hours. And the form that you fill out is not extensive. And it's not patronizing, and it's very honest and human. And it's like a person is speaking to you like you would speak to one of your friends, rather than really jargony, really like loaded with legal language, loaded with whatever. It's really simple and easy to understand. So sort of like those two things are in the same vein. Like, how do you humanize the barrier to access? Like, how do you make that just easier, quicker, faster, and like, again, nicer, human kind of thing.
Love it, Maggie. Humanizing the content, the interventions, the programs, and then this idea of just this really practical idea. And Jamie, we see it in your space, across the construction industry, across the unions, consolidating those programs, ease of access, very clear flow. Maggie, your word. So Jamie, you kicked us off. You started us down this path of kind of those actionable things. You talked about a card. The word that Jamie, you and I often use is operationalizing. Okay, big word. But how do you operationalize this stuff? We've got consolidated resources. We've got a flow. We've humanized. We're addressing stigma. We're following the data. Jamie, what sorts of things have you done to operationalize this stuff? And maybe for those that are attending, if you could define in your words what operationalize means.
And so, again, Brian, when we went back to just what was driving, what really was the root cause of the accident, or what was influencing judgment? What was influencing people's behavior on our projects? And we have all the rules, we have the plan, yet we were still having people get hurt, or we're having issues or issues with the work. And we had to get back, okay, what's really driving and influencing behavior? What we found was the awareness campaigns were huge, and awareness campaigns where it wasn't just about communicating the resource, and that is a piece of it. Do you know where the resources are? But it was bringing meeting the workers where they were at, and getting to the job sites, bringing these the EAPs in, and that was the first step of having people come in to say, we found maybe needles on the job site, or we had an overdose. Okay, we just ship them off. They can't work here anymore. You go back to work. How do you really address that? So we would have what we call kind of like an after incident event. And that was really the first time we did this stand down. We were at a Harvard University job with 800 people, and we tried to police it out. It was unsuccessful. We could not police the problem away. So we brought in the EAPs and the unions and people, and it was just an amazing experience the first time we did it. When you had, this leader iron worker get up, in front of a microphone, in front of 700 other construction workers, and talk about you know, his past addiction and substance use and the treatment and how it's got him here. And we also had a mayor, Martin Walsh, who's now the Secretary of Labor, who was a big help. He was the head of the building trades at one point, the mayor, and he's very, very open about his substance use struggles and recovery and peer-to-peer support. So we've had him out on the jobs even before he was in the position he's now. But by bringing people to where the workers are at and starting the conversation there, that was super powerful. The next day, people coming around and sharing that story. And then it went to, you know, those peers on the job owning it and almost being respected for recovery, not looked down on it. And then setting that tone with everybody. Hey, this isn't something that, you know, we're going to fire you for or judge you for. We're going to respect you for getting help. So those were the right messages rather than, hey, here's the number, you know, move along. We were trying to make it grab it more with more emotion at those. And when you bring in these EAPs, these recovery coaches, these folks, man, they've got the emotion. They are there for a purpose. It's not a paycheck for them. They're there for a purpose. So that was a piece of it. The other piece was training, right? And you know, framing the problem, understanding it, understanding the statistics, CDC, pulling it all into one place, and then having conversations with leadership, with management, and making them more aware. Not that, hey, you have to now manage this too. Here's another brick on your shoulder while you're building the building. More of just support for them, because everything we tried to frame with our workforce, it's all about them, and everything relates back to your family too. Everything we talk about in this is it can be for your brother, your sister, your family, your kids, or your employees or your coworkers. So that was a piece that was it really it was good information for everyone. So the awareness campaigns, then some just, it was basically what we called it was behavioral health literacy, I think is the term that, you know, Lisa developed for us. And so we just had a general understanding. We saw it from the same point of view, and we had the same language to describe it. From there, then it was partnering with the EAP's awareness campaigns, to the place where, you know, you dig into the resources. Are they good? Can they get there? You know, what are the partnerships out there with the unions? Peer-to-peer, of course, creating that space, keeping the stand downs going. And then bringing in the coaches. The wellness coaches were huge for us. That is the next evolution for us, and it's really took off nationally now. And you can see it's creating a tipping point, really. The toughest part with the coaches is, again, you know, someone has to pay for this. If you're building a giant building and there's someone on staff there for this, say, wait, they're not putting bolts and making walls. What are they doing? This cost me X amount of money. And really actually getting to the point where you can showcase the work and show how this provides value, how it keeps people safe, how it keeps people productive. And it really is all about the work. This is about the work. Yes, it's good, and it's a good thing for humanity, and we care about people. But this is what you have to do the work. And trying to tie that back in is huge. If that's a great tool belt, just if you need support, and I guess I'm looking at the audience here, like, yeah, I want to go do this, but how do I get my GM, my ops manager, my people to do this? How do I get the client to get into this, you know? So that's really the tricky bit. And you got to showcase those wins, testimonials from the workers. There's this feedback loop, right? We go do this and you'll get this, but we don't ever go back to them, you know, and say, hey, there's what,
Yeah.
you know, get that feedback loop. So I think capturing things and bringing the feedback back is huge too. But like I said, we got a long way to go. As JJ said, you know, chronic pain, you know, not if you don't go to work, you don't get paid. So we have a presenteeism issue in our business because people show up when they shouldn't be.
We're going to come back to this concept of presenteeism, but I want to make sure, I want to punctuate, Jamie, something that you said, and I wrote it down because I always attribute this movement from policing to recovery. I always think about Turner, and I think about what you guys are doing at Turner, and your words were, you could not police this problem. You could not police this problem. Pardon me. Policing isn't the solution, never has been, never will be. Your movement to a recovery-oriented culture just, I don't know, leaves us inspired. That stand down that you referenced at Harvard, Jamie, to this day, and I can speak, I think I can speak for Lisa Desai, who's our Chief Behavioral Health Officer. She and I were at that stand down. Nothing moved me like that stand down did. So in terms of operationalizing things, training, stand downs, I know that your morning huddles, Jamie, have changed as a result of this effort. But you couldn't police this problem. I loved that you said that.
Yeah, and Brian, just one more, because I think it's super important.
Yeah.
Is the crew leader training. Like that is still like that, what we call the foreman or four-person, JJ. But we have a lot of women, they still like the term foreman, but we really adapted to crew leader now. That crew leader having the training in the general understanding and maybe a trauma-informed approach with, hey, why is this behavior happening? Let's peel back and understand, and then move forward. But those foremen, what we call our daily huddles, now not just instructing on, hey, here's you need to have this harness on. It's really having them have a great appreciation for looking everyone in the eyes when they're in there, they're making their assignment, and understanding where you're placing someone based on, maybe what's going on with them. Yes, they've done this job every day.
Yeah.
But maybe, Brian has X happening and I don't need him on the iron today. I need him on the ground. Or maybe I need to take him aside and help him unload something. And then you can go to work. You don't have to solve it all. You just have to sometimes listen. And then now you can get, I guess what we're looking for is that production, that safe production out of the person.
Yep.
Which is good. So that's like operationalizing. The crew leader is so important. We have a long way to go there, but that can't be underestimated, that frontline manager.
JJ, something tells me you want to jump in on that. You're back on that. No? Oh, well,
No, yeah, absolutely. I'm always willing to jump in. I love what Jamie's saying, and and again, it's people in the community. The change starting with people in the community. I guess as far as actionable systemic activities that we can implement, I just want to separate it into two pieces, because I don't want to belittle the work that we all have to do as individuals in this country, because there are huge systemic change. Like, there aren't enough providers. That's going to take years to flow through the system. People have to be trained. People have to be, inspired or incentivized to go into behavioral health. It's going to take, we need beds. We need science. We need research. Those are big things that we all need to think about when we vote and when we think about our philanthropic dollars. And then, given that context of the need for large change, what can we do in our own worlds? And I think it gets to what we've been talking a lot about today. In my world, we deal with a lot of independent workers, but it's similar. If you have a larger company, I think that there are people in every family, in every community. When someone is sick, there's someone that is going to make sure that food is delivered to them and that they have rides to the doctor. If you find those people in the workplace and provide them training for the work that they're already doing, it becomes an incredibly efficient community health model. I think the next piece, to me, I mean, for independent workers, every thousand fishermen we can find, we think there should be a navigator in that community. We think the next piece is they should be signing people up for healthcare coverage. If you don't have healthcare coverage, you can't access the services that you need. You just don't have the money to do so. And then the third piece, and I don't know if this is gonna be good with you and Lisa or not, but the third piece is to connect with a group like Mindwise Riverside. It's been our relationship has been absolutely critical in the absence of that large systemic change to be able to bring in a group of trauma specialists after an incident, whether that incident, I mean, is a financial incident. I mean, we've done, you know, we try to do trauma-based everything now. We did trauma-based, you know, we got a bunch of fishermen together for a focus group about fisheries, you know, ocean policy. And we brought in Riverside because we knew how hot the fishermen were going to get now. And so to you know, to connect with organizations, agencies like Mindwise and Riverside for post-incident care and ongoing therapy is critical as well. I mean, those are the three things we would do.
JJ, thank you for that. You know, here's the unfortunate thing about doing this virtually is, like, there have been a couple of times when I wish I could, like, high five you guys, hug you guys, like, you know, knock it out, you know. I mean, it just, JJ, thank you for that. Really, really, really appreciate the conversation thus far. What I want to do is, we've got, can you believe it? We're down to about 20 minutes remaining. So I do want to open it up to questions from any and all participants. I want to know, all of you out there, please chime in with your questions. We're going to continue the conversation, but we will stop when a question comes in. I'm curious what all of this has meant to each of you personally. Maggie, you used the word journey earlier. Jamie, you alluded to your journey. Like, what has all this meant to you? How has it changed who you are? How do you think about your day-to-day as you move through it as a result of all the work you've done thus far?
I'll jump in if you want, or right?
Yeah, go for it. Yeah.
I don't mind talking. I think how it's affected me personally, I'm extremely grateful. I'm extremely grateful that I'm fortunate enough to work for an organization that gave me the space to go and learn and engage people. And you know, and the freedom, I guess, and the trust to go and do that. So I'm forever grateful for that. You know, an organization, I guess, that continuously wants to improve, right? And personally, for me, how it's made me doing this work, as again, we're not clinicians, we build buildings, right? We build buildings, and we try to deliver on our promise to our client. That's what we do. But personally, again, with gratitude, how it's changed my approach on how I deal with conflict, how I see people. Instead of view people, I actually see people. I feel getting into this work and learning and discussing it, what happens is it organically becomes a part of you. And you know, maybe it's, I don't want to say softer, but it's maybe, you know, seeking to understand a little bit more, you know, appreciating people where they're at, maybe where they came from, understanding what's driving people, that person, where I can help with just this is stuff that is, you learn about this, it's kind of, it's wisdom, you gain wisdom. And for me, being able to have that gift through work and almost forced into it by the need of the population, I'm glad I did it when I did. And I can understand that now. I show up as a better husband. I show up as a better father, for sure. Absolutely. Absolutely. As a better dad, and a son, and hopefully a friend, and a colleague, and a better leader. I really, I hope that, I know it has. So for that, I'm just very grateful, you know. That's
again, Jamie, if we were in person, you know, we'd that warrants a hug. Beautiful. And I saw some nodding heads. It appears to me, Maggie, JJ, that those words resonated. We do have a question, so I want to get to the question, and then we can circle back to that, the question that Jamie just so eloquently answered. Catherine Cunningham asked, what are ways that a social worker clinician could shift their career path to a workplace mental health position? Love that question. Anyone? Anyone?
Well, I would say that, you know, our model at Fishing Partnership is a social work sort of based model, and I say that because I'm married to a social worker and just stole every good idea I have from her. And we have our vice president of research and our vice president of community health, and one of our navigators are all social workers. So I think, you know, as Maggie has said, there's for all the reasons we discussed, there's going to be a great need. I think there are going to be plenty of positions. So it's really, I would suggest, you know, this is just keep your eyes open for the type of work that you'd like to do within behavioral health, and you know, I think it'll be there, and I really appreciate your interest.
JJ, love that. Catherine, I'll quickly chime in. You know, roughly 3 years ago, myself and Dr. Lisa Desai sat down and said, you know what, let's put a stake in the ground. Let's title a new role. Let's create a new role. Let's call it a Chief Behavioral Health Officer. I think part of why we did that was to influence other organizations to think at the, forgive the business speak, but to think at a CXO level, to think at an executive level, the role of behavioral health. In addition to HR, in addition to finance, in addition to all those other executive positions. So what we've seen, not necessarily because we did it, but what we're seeing, our roles are evolving. Maggie alluded to this, Jamie alluded to this. The work we do today is going to look very different in 12 months from now, 18 months from now. And the more there is behind behavioral health, the more energy there is, the more organizations are going to look for CBHOs, are going to look for the roles that JJ, Maggie, and Jamie are talking about. So thank you for the question. It appears, one more question, I think. Another question. Have you experienced regulatory or policy barriers to making the wanted changes to behavioral health in the workplace? Regulatory or policy barriers?
I can answer, I think, from a recovery standpoint, like your substance abuse drug policies, that they're very probably based on like 1980s. 1980s. So a lot of those policies there need to be updated. So from an internal policy perspective, that's one. The other piece is you gotta partner with HR. They gotta come on this journey with you. I'm very fortunate that one of the first things I did is just grabbed HR by the hand and, hey, let's go together. Here's where I'm at. And it's been incredibly helpful because once we opened up the door here in the pandemic, you know, when that happened, everybody was trying to support their people, and they didn't necessarily know how. When you get an email saying, I need help or I'm going to die, and it goes to HR, and a panic happened, like, am I prepared for that? So part of it was the policies that were there that that maybe didn't support the problem of where we are today and 5 years ago with the opioid crisis and what we need to do. Also setting up those new policies or protocols that, you know, these things are showing up: rage issues, addiction, overdose, depression, risk of suicide, these are showing up at the workplace. Are we affording our people the skills or the training to be able to volley those in that moment? So from a policy standpoint, I would say those two things, Brian.
Regulatory policy. I think we've all had to, in some way, shape, or form, shoulder an awful lot coming through the pandemic. But what I find, and I hesitate to say this, so I don't want to be misunderstood, but what I find, the function that is shouldered more than other functions within the business is HR. Human resources has shouldered an awful lot moving through the pandemic. And I'm just going to call it as I see it. I think there's also a burgeoning, for lack of a better word, anti-woke movement happening. And whose shoulders is that sitting on? It's sitting on HR. So Jamie, to hear you say partner with HR, pull in HR, absolutely. We can't be afraid of HR, can't be afraid of legal, can't be afraid of risk management functions. They all have to be a part of the solution. And it goes back to how an organization manages change. Can you get that organization to possess a shared understanding of current state? JJ talked about data earlier. JJ talked about stigma earlier. Can you get an organization aligned on what their current state is, how they view current state? So,
Brian, can I ask you a question?
Yeah.
So do you feel like we have had a lot of change in the last few years? And one of the things I see organizations across the board is trying to train, teach, instill empathy, right? And inclusion. Do you find in your work that the organizations that were already proactive with mental health, behavioral health in the workplace and having those conversations were since the murder of George Floyd, were those conversations around inclusion and empathy easier for those organizations because they had that foundation of stigma reduction, mental health, taking care, active caring for each other, genuine care? Because I think that's interesting. I've seen that from our standpoint in other organizations, but I'd like to hear your thoughts on that.
It is so much of this sits in culture. So much of this sits in how the organization thinks about itself and functions as an organization. To answer your question, we early on, 3-4 years ago, was the progressive thinking organizations. And I'm not saying progressive in a political sense, but the progressive thinking organizations, those that saw this coming, those that weren't afraid to stand up ERGs, employee resource groups, those that weren't afraid to address the inequalities even within their own workplaces, are those organizations that have prioritized empathy, that have prioritized the continuing of training, interventions, solutions. There are others that want to get there. There are other organizations that want to follow in the footsteps of Harry's, that want to follow in the footsteps of Turner. But Jamie, as you know, it's hard for an organization to change. So we come in, we spend a lot of time early on getting them to recognize how their culture shows up. How is their culture moving them forward? And in some ways, how is their culture impeding their ability to move forward? To really, it's, Maggie, I think it was you that said it earlier. It's kind of fun right now. It's fun to be and experience all this. It comes with heartache. It is some of the hardest work I've ever done, but it's kind of exciting to be in this space right now. Any other comments to Jamie's question of me? What are your observations? Anything?
I would just say, when we were thinking about doing mental health training here at Harry's, we actually started, we didn't even call it mental health training. We just called it sort of like Empathy 101, which we all know, which is helpful, I think, for a team and makes it a little bit more accessible, because you can start to think about, your job and you yourself as a manager, but you yourself as a parent, as a friend, as a daughter, son, brother, person, human being, which was really helpful. I think like empathy 101 is so important, and it's going to, you want a more empathetic workforce, someone who's going to say, okay, the conditions to me and my life, I would react differently than someone else. It's like truly what empathy is. It's like, but really breaking it down, I think really can make it so much more accessible, and feel less heavy than something like mental health training, where you're going to be asked about, you're going to be approached by someone and you're not going to know what to say. But within empathy training, as we all know, there's like formulaic things that you do. You ask coaching questions, you ask more questions, you listen, you ask follow-up questions, you try to co-think with that. There's all these things that you learn, that I think is like, even it's a precursor to like mental health training, which makes, this work just like so much more accessible, and I think less intimidating.
Great. Again, something for all of us to tuck in our back pocket and take with us. It's humanizing the content. I get excited about this topic. I grew up with a father that was very much focused on workplace health. I remember him first introducing me to Dr. Walter Edwards Deming. He was someone in the 60s and in the 70s, talked about removing fear from the workplace. Now think about that for a minute. Removing fear. How do you get fear out of the workplace? And here we are. Implementing focused, efficacious programs that do, to a certain extent, that removing fear so that each and every one of us can show up and exercise our own voice, feel like we have a voice, feel like we can inform our boss that I'm not feeling up for the day, I'm feeling injured, I'm experiencing pain. So what do we do to remove fear from the workplace? Maggie, JJ, Jamie, I mean, we could go on and on and on. Any just final comments, final words of wisdom, again, something that you want each participant to stuff in their back pocket, before we wrap up in 5 minutes. JJ, what's your stick it in the back pocket? We were all fishermen. We're all fishermen.
Yes, yeah. I think I just would like to say I deal mostly with independent workers who don't even have a human resources department. And so what I would really just love for everyone to think about workers in this country who have who work with their bodies, who have high rates of pain on the job, and who have don't get paid time off. And if you think about them at your work site, you can expect that that they are going to have difficulties that other workers may not. And the other is just what everyone has said. Communities in need, the last thing they need is someone else with a graduate degree telling them what to do. All the solutions are going to come from the communities.
Thank you, JJ. Jamie, something to stick in our back pocket.
Well, a couple of things, I guess. One, I think if we're going to get people well, keep people well, it's got to happen at work, and companies have to lead. You can't wait for the government to do it for you, the state. Work companies have to lead. So that would be the one piece. And then just to reiterate what you said, it's funny, I have this sticky on my computer. This wasn't rehearsed, by the way, and it just says, I don't know if you can see it or not, remove fear. The only sticky I have in my office, and it hangs on the thing, and it says remove fear.
Yeah.
To your point, Brian.
Jamie, we've I don't know, we've always had like this strange kind of cosmic connection, but love that, Jamie. Thank you. And Maggie, you get to wrap us up. So
well, no pressure. There's
So-
nothing but like, you all are the experts. I am not, but I would say one thing that I think I've stepped away from this experience, and starting, only really focusing in on mental health 5 years ago. This is new-ish to me, in a, professional sense, taking on this issue. I think at first you can get really tripped up on the stats and the rates of suicidality. Like there's just so much depression and anxiety. You start to really feel it. And I just say, like, keep moving through that, because the amount of solutions and just like such creative thoughts that are happening and creative solutions that are out of the box community care, like it is not just like a psychologist and seeing a therapist. There is so many different amazing solutions out in the world, and I think if you can get over that hump of, like hearing all about it and feeling overwhelmed about it and feeling like there's no solutions, like if you can work through that, you will see all of the solutions that are out there and the joy in it. And that, like, this is not all doom and gloom. This is not, we had to ask this question, like, do we want to be the brand that talks about suicide? Like, do we want to be the brand that talks about suicide? But the truth is that there is, yes, like we do think it's worth it. We think that there's actually so many cool solutions and actual resources that we could give people that they will actually use, and they will read their email, and they will take a screener, and they will use crisis lines that we provide them. Those things are just, I just say, like, ride it out a little bit. And then I would say, just because someone asked the question about leadership just in the Q&A, and I just feel compelled to like respond, like getting your leadership buy-in, I think is so key. But my caveat to that is, I think sometimes leadership, or sometimes it's like translated to leadership, need like these big PR stories or something about how their journey with mental health, or they've had this like bipolar disorder, or I've had this type of thing, and like they feel like they need to tell this story, to this connection to mental health, when again, I think it's like it can be such like simple work. For example, like our leadership says, when things aren't okay right now. Like the world doesn't feel okay. Like even that, I think, is like how you get leadership buy-in and setting a tone for an organization and a company. You don't need a whole big story. You don't need to violate anyone's privacy. You don't need to like go there. I think just being an empathetic person can set the tone. So sorry, I just had to answer that question, because one, I've learned so much in the past few years in working with our leadership on this, but also it's like my need to check off all of our questions.
I'm not going to say anything, Maggie. That's a wonderful way to wrap the panel. Guys, Maggie, JJ, Jamie, I've said it 1,000 times. Thank you. This meant the world to me. This meant the world to Mindwise, and I hope it meant an awful lot to our participants.